thoughts about the history of depression because I think it's really interesting that, we always think that the way our society works is we think that we're the first ones to have discovered anything. But it's interesting that if you go to Wikipedia, and it's not very far to look, you find out that in ancient Greece, there was disease, or it was thought to be due to an imbalance of bodily fluids or humors, which brings me to hormones. So I guess the ancient Greeks, it took us from ancient Greece to now to realize that hormones are very important in balancing our mood as well as everything else. And then in Rome, a physician by the name of Galen, who any physician knows is pretty much considered one of the fathers of medicine, started talking about melancholy, but it was called melancholia. And it was a broader concept of today's depression and included feeling sad, dejected, despondency, and often fear, anger, delusions, and obsessions. So this is like thousands of years ago you're talking about. Persian physician Avicenna, which is another major physician in the 11th century, described melancholy as a depressive type of mood disorder in which the person becomes suspicious and develops certain type of phobias. In the 17th and 19th century, people were diagnosed with depression, and they had depleted energy, slowed circulation. Depression continues to surface in the 1600s, 1700s, and it includes depressive disorders and affective disorders, which are really medical terms that eventually sum up to the fact that what we called manic depression, but now they're mood disorders. And finally, you go to the father of psychoanalysis, who in 1917, Freud, who in 1917 wrote about mourning and melancholy, and what he said that the loss of a relationship, of somebody important in your life through death or a romantic breakup, resulted in a really subjective loss of well-being, and that the person became so depressed that it was more than mourning. And so this is Freud. So depressive reactions, the DSM, the diagnosis code that we all use, started in the 1950s, and it contained depressive reactions from the beginning, and then just started breaking them down into more and more separate and identifiable diagnoses, that eventually it became a real confusing thing. And by the mid-1970s, the term major depressive disorder became incorporated in the conversation. And so the first drug that was ever used as an antidepressant was isoniazid, which ironically is the most important drug in the treatment of tuberculosis. So I guess it's an antidepressant. And in the 50s, they finally figured out that the neurotransmitters, the hormones that occur in the brain that send messages between different brain cells, actually affect your mood. And then we started looking for drugs. So it's interesting that if you look at this, that depression is not something new, and it's not something that we actually developed in our century or in our culture. And I think it's important to realize that people have dealt with depression and issues of mood, what we call disorders now, from the beginning of time. So how did they deal with them before they had medication? Well, I think that people realize that, as you know, diet, exercise, and lifestyles are crucial. So if you're depressed or think that you have a reason to believe that you are depressed, what you really want to do is, the first thing you want to address is, am I depressed for a reason? So if you lost your job, you lost a loved one, you lost your home, you're in a situation that you're not happy with your life, the first thing you want to do is, that's a normal reason to be depressed. how long you stay depressed and how this depression affects you and your ability to seek a job or to go to work or to interact with others or to come out of the house and go out to lunch or dinner and hang out with friends and be part of the community, that really defines if this is a serious depression, if it's something that needs medication. And I think it's really important to realize that our society, we jump to medication before we address other issues. And, it's normal. And it's normal to be depressed when you have a reason to be depressed. It's not normal to let the depression define you. It's not normal to allow the depression to run your life and for you to just kind of curl up into a little ball and not get out of the house because depression has been given to you as a diagnosis. And I think that that's the most important piece to take. So I'm going to